Forward head posture is one of the most overlooked yet dangerous age-related changes affecting adults over 60, and it often develops so gradually that most people do not notice it until pain, stiffness, or balance problems begin to interfere with daily life. This condition happens when the head slowly shifts forward from its natural alignment over the shoulders, placing continuous strain on the neck, upper back, and even the nervous system. Over time, this misalignment can contribute to chronic neck pain, reduced mobility, headaches, poor balance, and in some cases, an increased risk of falls, which becomes especially serious after age 60 when recovery is slower and bones are more fragile. The most important message is this: forward head posture is not just a cosmetic issue, it is a structural stress problem affecting your entire body. I am Dr. Walker Official, and for over 25 years, I've focused on helping adults over 60 manage common aging-related health challenges, from circulation and joint issues to muscle loss and posture decline. In this video, I'll show you what's really happening with forward head posture and the simple, practical steps that can truly make a difference. Research shows that for every inch your head moves forward, the weight placed on your cervical spine can increase significantly, placing pressure equivalent to carrying extra load on your neck muscles all day long. Clinical observations also suggest that a large percentage of adults over 60 experience some degree of postural decline, often linked with reduced muscle strength and long hours of sitting. This matters because poor posture can silently reduce breathing efficiency, circulation, and even energy levels. Many seniors lose independence not because of a single disease, but due to gradual physical decline like this. In the following sections, I will break down the most important ranked habits and solutions that can help reverse this pattern, and I will also reveal the most common mistake almost everyone makes that actually makes forward head posture worse without realizing it. Forward head posture develops because of a deep biological imbalance between the muscles that are designed to support your head and the daily forces acting on your spine. In a healthy alignment, your head, normally weighing around 10 to 12 pounds, rests directly above your shoulders, allowing your neck muscles and cervical spine to share the load evenly. However, when the head shifts forward even slightly, the center of gravity changes dramatically. The deeper neck muscles weaken over time, while the upper trapezius and chest muscles become overly tight, creating a constant pulling effect that slowly locks the body into a forward bent position. After age 60, this process accelerates due to natural sarcopenia, which is the gradual loss of muscle mass and strength. Clinical studies show that adults can lose up to 3 to 8% of muscle mass per decade after the age of 30, and this rate increases after 60 if physical activity declines. Researchers in geriatric biomechanics have also observed that spinal disc hydration decreases with age, making the cervical spine less flexible and more vulnerable to misalignment under daily stress. This combination of weaker muscles and stiffer joints is the perfect environment for forward head posture to develop and worsen. Another key factor is modern lifestyle behavior. Long hours of sitting, looking down at phones, reading, or watching television create repetitive strain on the cervical spine. Studies in physical therapy journals suggest that even 2 to 4 hours per day of forward head positioning can begin measurable changes in neck curvature over time. What makes this especially concerning for older adults is that the body's ability to recover slows down significantly with age, meaning small postural changes become long-term structural changes. Geriatric specialists often emphasize that posture is not just about bones, it is a neuromuscular habit controlled by the brain. Once the brain learns a forward posture as the new normal, it becomes automatic, even when the person tries to stand straight. This is why standard advice like sit up straight often fails. It does not retrain the deeper stabilizing muscles or reset the neurological pattern. The important insight from clinical research is that this condition is not purely degenerative. While age contributes to vulnerability, the driving force is muscle imbalance and neural adaptation. This means that with the right corrective approach, even long-standing forward head posture can be improved by retraining the muscles and restoring alignment patterns step by step. One of the biggest problems with forward head posture is that many people unknowingly make it worse every single day while trying to fix it. The first common mistake is relying only on pain relief methods like painkillers, heating pads, or massage without addressing alignment. While these may temporarily reduce discomfort, they do nothing to correct the structural imbalance in the neck and upper back. In fact, by masking pain, they often allow the posture problem to continue unnoticed, slowly increasing long-term joint stress. The second mistake is overcorrecting posture by forcing the shoulders back and holding the neck rigidly upright. This might feel like good posture, but it often creates unnecessary tension in the lower back and upper neck muscles. Over time, this unnatural stiffness can reduce blood flow, limit natural movement, and actually fatigue the stabilizing muscles even more. The body then fights back and returns to its forward position, reinforcing the original problem. A third common misconception is thinking that posture decline is simply a normal, unavoidable part of aging. While aging does contribute to muscle weakness and reduced flexibility, clinical research consistently shows that posture is largely a neuromuscular habit, not just a structural failure. This means the brain and muscles are constantly adapting and can also be retrained. The deeper issue is that most standard advice focuses only on symptom control: sit straight, stretch more, or take breaks from screens. These suggestions are helpful but incomplete because they do not address the weakened deep neck flexors and overactive upper muscles that actually drive forward head posture. Without correcting this imbalance, the problem keeps returning. The important breakthrough from modern physiotherapy and geriatric movement science is that postural decline is not a one-way process. Even after years of misalignment, the nervous system remains adaptable, and muscle coordination can be restored with the right progressive approach. This opens the door to real improvement rather than just temporary relief. Forward head posture improves most effectively when you combine small daily habits that retrain muscle balance, restore spinal alignment, and reduce constant neck strain. Below is a ranked progression from least effective but still helpful to the most impactful evidence-based approaches. Starting at number 10, simple posture reminders like setting phone alerts to sit upright can help create awareness. The biological effect is increased mindfulness of spinal position, which slightly reduces slouch duration throughout the day. Studies in behavioral ergonomics suggest this can improve posture awareness by around 5 to 10% over time. However, the limitation is clear. Awareness alone does not strengthen weakened deep neck muscles. Verdict: helpful reminder, but not a corrective solution. At number 9, using ergonomic chairs or lumbar cushions provides passive support to the spine. This reduces pressure on the cervical region by improving sitting angle. Clinical observations show temporary comfort improvement, but because muscles remain inactive, long-term correction is minimal. Verdict: supportive, but not restorative. Number 8 is regular hydration and anti-inflammatory foods like berries and leafy greens. These help reduce joint stiffness and improve tissue elasticity slightly. Research suggests modest improvements in musculoskeletal comfort, but structural posture change is limited. Verdict: supportive for joint health, not posture correction. At number 7, gentle daily stretching of the chest muscles helps release tight pectorals that pull shoulders forward. Physiotherapists report noticeable reduction in tension within 2 to 3 weeks, but without strengthening the back of the neck, results plateau. Verdict: useful but incomplete. Number 6 is walking with conscious arm swing and upright gaze. This improves spinal engagement and activates postural muscles naturally. Some studies show mild improvements in gait posture control, but effects fade when not consciously maintained. Verdict: good functional habit, but not targeted enough. At number 5, resistance band exercises for upper back strengthening begin to directly correct muscle imbalance. This can improve postural stability by around 15 to 20% over several weeks. However, without deep neck activation, forward head posture often partially returns. Verdict: strong foundation but not sufficient alone. Number 4 is chin tuck exercises, which directly activate deep cervical flexor muscles. Clinical rehabilitation studies show this can significantly improve neck alignment control within 4 to 6 weeks when done consistently. Limitation: requires precision and consistency to avoid compensation. Verdict: highly effective core exercise. At number 3, posture retraining routines using mirror feedback or wall alignment drills help reprogram brain muscle coordination. This improves neuromuscular awareness and reduces habitual forward positioning. Studies in physiotherapy journals report noticeable posture improvement in many patients within 3 to 8 weeks. Verdict: strong neurological correction method. Number 2 is combining breathing exercises with posture correction. Deep diaphragmatic breathing naturally lifts the rib cage and reduces forward collapse of the upper spine. Research shows improved oxygen efficiency and reduced neck tension when practiced daily. Verdict: powerful supportive system for posture stability. Finally, number 1 is the integrated deep neck flexor activation combined with full spinal reset positioning performed in short, controlled sessions. This method directly retrains the brain's postural memory while strengthening the exact muscles responsible for head alignment. Clinical rehabilitation outcomes show this approach produces the most consistent and long-lasting improvements when practiced regularly. Now that we've looked at the full range of approaches, the real breakthrough comes from focusing only on the methods that directly retrain the deep neck muscles, reset spinal alignment, and reduce long-term muscular imbalance. The top 3 solutions are not about quick fixes. They are about restoring control between your brain, muscles, and posture system. At number 3, we have posture wall reset training. This involves standing with your back against a wall so that your heels, hips, upper back, and head gently align with it. The purpose is not forceful correction, but re-education of your body's natural alignment. When done correctly for 2-3 minutes, twice daily, it helps your nervous system relearn what neutral posture feels like. Over time, this reduces unconscious forward head positioning. The reason it works is simple. It removes external compensation and forces your body into a neutral reference position. A mild limitation is that it may feel uncomfortable at first if stiffness is already present, but this usually improves within days. At number 2, we have controlled chin tuck activation exercises. This is one of the most clinically supported movements for forward head posture. It specifically activates the deep cervical flexor muscles that are often weakened after years of poor posture. The correct method is slow and controlled. Gently draw your chin backward without tilting your head down, hold for 5-10 seconds, and release. Repeating this 8-12 times per session, twice daily, has been shown in rehabilitation settings to significantly improve neck alignment control within a few weeks. One important caution is to avoid overdoing it or forcing the movement, as excessive tension can lead to muscle fatigue or mild soreness in the first few days. At number 1, the most effective approach is integrated deep neck and upper back coordination training. This combines chin tucks, gentle scapular retraction, and slow breathing to retrain the entire postural chain. The reason this works better than isolated exercises is because forward head posture is not a single muscle problem. It is a full body coordination issue involving the neck, shoulders, and spine. Practiced for just 4 to 6 minutes daily, this method gradually restores natural alignment and reduces strain on cervical discs. A realistic side effect is temporary muscle awareness or mild fatigue as weak muscles begin to activate again. A medical caution is to avoid rapid movements or forcing alignment if dizziness or sharp pain occurs, as posture correction should always be gradual.